Here are the signs and symptoms of vascular occlusion, which signal that the filler may be injected into a blood vessel. Almost immediately after the injection, you may notice a blanching in the area where the skin starts to look pale because of a lack of blood flow to the tissue. The skin will then continue to change color, turning red and then getting mottled, looking kind of purplish with areas of paleness mixed in between. Inexperienced injectors may confuse this mottling for bruising. The skin in the affected area may also feel cool to the touch. These skin changes will often extend outside of the bounds of treatment depending on the distribution of the blood supply affected. Another way to check for vascular occlusion is to assess the capillary refill of the tissue. Capillary refill is the amount of time that it takes for blood flow to return to the tissue. The best way to check this is to take your finger and put firm pressure on the tissue for about 8 to 10 seconds. In normal situations, when you release your finger, that tissue should pink up within 3 seconds. In cases of vascular occlusion, it may take longer than that 3 seconds for the blood flow to return to the tissue if it's been impaired. You may also have an excessive amount of pain and discomfort after your procedure if the blood flow has been compromised. Usually, filler injections should only have minimal discomfort after the treatment. If you're having a lot of pain, that could signal that something's wrong. Numbness may also be experienced. If left untreated, you may start to form little pustules in the area and the tissue will slowly start to turn black. These are all signs and symptoms that should be explained to you at the conclusion of your treatment. If you start to experience any of these, it's important that you contact your injecting provider immediately. Prompt treatment is essential in making sure that things resolve without complication. Drop any other questions in the comments.